So to those 530 that are on, I know that we had about 1,000 that registered for this, so we're just going to hold on a few more minutes and let it all fill in.
We are live on Facebook too, Brian.
Okay, well, I think we're going to go ahead and get started. First of all, thank you everybody for joining in today and taking time out of your day to join in with this Disability Town Hall. My name is Brian Calley, and I'm the president of the Small Business Association of Michigan, but not really here in that capacity, more in the capacity of being the father of a child with a disability who's out of school, and like a lot of you that are watching, just kind of trying to feel my way and feel our way through how we navigate the COVID-19 crisis when you have a disability, or a person in your family or somebody that you care about has a disability. So I had reached out to the governor a couple weeks ago, and we started a conversation about how we can speak to some of the needs and connect people with available resources and take some input and feedback to try and anticipate what some of the needs are going to be now and into the future. And so that's really the genesis of how this conversation started. And the governor is going to be joining us in a little while. It's a very, very busy day at the Capitol, so we definitely appreciate her willingness to be available for this. And before we get to her, we've got some advocacy and service organizations that we just want you to become acquainted with if you don't know about them already. And we're going to start with the Special Olympics of Michigan. Tim Hileman is the CEO. He's, I guess he's not that new anymore. He's been on the job there for over a year, I believe. And a lot of great things that have been happening at Special Olympics. But also with these challenges, seeing how sporting events are not allowed at the moment, they're finding new and creative ways to engage with families. So let me turn it over to Tim to talk a little bit about what Special Olympics is doing and how to connect with them.
Great, thanks so much, Brian. So I think a lot of individuals are familiar with Special Olympic sports programs, or even the cold dip called polar plunges. But really, Special Olympics is an inclusion organization where we not only utilize sports, but health, education, and leadership programs. And we say our goal is to empower individuals with IDD and work to create an inclusive world. And so while not having practices, tournaments, and events has been really hard, because we're a lot of event-based organizations, it's been hard on our staff community, but especially hard on our athletes. Special Olympics International, Special Olympics Michigan have really produced some great resources for individuals around the state to remain healthy at home. We've been providing this to our athletes, coaches, over 400 unified schools, and was really excited when you reached out, because we want to be able to share this with as many other organizations or families out there. And so the work we've been doing now really over the last couple of months, and kind of this pivot to virtual, has focused on remaining healthy. And we know that remaining healthy not only involves physical health, but emotional health as well. So how do we continue to provide resources, assistance for individuals to remain physically and emotionally healthy? And so one of the things that we're really proud of is saying that we think we have, programs and resources, something for everyone. So for families with children ages 2 to 7, which we called our young athletes, we have online resources that combine play, motor skill development activities. There's flashcards, there's follow-along activities. So if you have young ones at home and trying to figure out what do we do during this time, that's a great resource. For older individuals, we have, with maybe more severe physical or intellectual disabilities, a program called MATP, with motor activity training program of just movement, getting out, different activities. We have lots of different virtual workout programs or fitness programs occurring right now, where there's live staff at times of SOMI on our Facebook leading workouts. There's a fitness program called Fit 5, and then a modified program that Special Olympics staff have put together called SOMI Fit. And again, we'll send out all of our contact information about this so families can get involved for that. And for those, not only just staying active or fit, say, you know what, I want to, improve upon our sports. Special Olympics also is sports. And so we have different training or practice drills for individuals to, improve on a sport or maybe learn something new. But from the fitness, activities, engagement, we've been really excited with the progress and support with our athletes. There was a recent newspaper article of one of our athletes in the Big Rapids area that lost 25 pounds from all of this. And he really committed himself to, engaging and staying healthy. But outside of physical health, as I mentioned, the other big component is emotional health. And we know that's a crucial need for all of us. So there's a program called Strong Minds. It's an interactive learning program focused on increasing awareness of just multiple coping strategies, activities to maintain healthy emotional, times under stress, where we know this is a stressful time for everyone. And then, kind of lastly, as I mentioned, we talk about really inclusive activities and support. And we have things with our school programs that have been used for educators, but also at home in different groups, focused on just inclusive leadership. Lastly, I'll just say, yesterday I was on a call with some of our athletes, and we were just kind of talking about how stressful social distancing and these times can be. And one of our athletes, and I always say, our athletes are the best leaders of Special Olympics Michigan. I've got the great title, but it's our athletes who are truly the leaders of our movement. And during that call yesterday, one of our athletes, made a really profound, insightful, and maybe almost kind of heartbreaking statement when he said, I'm kind of used to this. And that, really made us take a step back and say, we need to do a job in community and providers as much so now of how do we engage, individuals throughout the state now, but how do we really make sure that when we're through this and when the time is right and it's healthy for all of our individuals to come together again, how do we make sure that social isolation and distancing is a past for everyone? And, we really want to help be a part of that solution with the state. So I believe my contact information, the Special Olympics contact information is on there. Please feel free to get in touch with us via email or on Facebook and really, again, help to be a small part of the solution as we all kind of work through this together. So thanks so much, Brian.
Well, thanks, Tim, for joining us. And every time we talk, you have a really cool piece of insight that comes from an athlete, and the way that it really is an athlete-driven organization is it's inspirational, and it makes it that much more impactful. So thanks, Tim. Next, I'd like to introduce you to Sherri Boyd. She is the executive director of the ARC Michigan. And Sherri, if you could give us an idea of how, you're just such a powerful advocacy and service organization, yet now you're working in this virtual world like the rest of us are too. Give us some insight of what's happening at the ARC and how you're serving families today.
So we we have about 40 employees, and we're all working from home, but we're all still working. So we have our major work is in special education in terms of serving families through what's called Michigan Alliance for Families. And I believe the contact information will be in the notes of this. But I would encourage families who have lots of questions about what's going on with the online learning and your school's continual learning plan to call our regional parent mentors. And if you go to the website, which is going to be available in this webinar, you can find out how to get a hold of the person that serves your area. We have around 25 parent mentors around the state who serve families with kids in the 0 to 26 system in Michigan. So that's probably the biggest information in the terms of this audience. The other thing I would say is the ARC Michigan has 30 local chapters, and they provide advocacy and resources to families who have questions about how to get through all of this, how to help navigate, the CMH service system as everyone's going through the COVID pandemic. And but we have individual advocates at that level that can help with those issues in the public service system. So I think that's what you're looking for, but we primarily serve families in special education, and everyone's ready to go. We have certainly gotten a lot more calls recently this week since school started back up. And the other thing we're embarking on is trying to bring together small groups of parents to actually kind of talk about all of this, like working and trying to educate your kids at home or be supportive of that and how everyone's surviving that. So we're hoping to get some of those kinds of small group parent support groups off the, have them be available in the next couple weeks so that families will have an outlet to talk to other families across the state about how they're surviving or coping, if you will, to get through this. Again, I would encourage everyone to call with the contact information if you have any questions. The other thing we spend a lot of time doing is public policy advocacy, and we, have been in certainly dealing with issues of hospital and having people with disabilities have to make sure a person that can speak on their behalf is available to help them navigate and be heard. We've been talking about healthcare rationing because there's been a lot of that kind of thing going on in Detroit. And we've been also in close contact with Department of Health and Human Services around, the 1135 waiver authority and all the changes that will happen because of the emergency we're in terms of paying direct care workers more money. Of course, that's a good thing that came out this week, that the governor was going to be able to have that happen for folks, because we have people working on the front lines with folks who live in small groups, homes, or on their own, and they need that day-to-day support. I mean, they need it daily. So it's really important that we can keep those people working. And having said all that, I think those are the big things I wanted to highlight. So thank you.
Yeah, thanks, Sherri. And you had mentioned, now that school is starting back up, of course, virtually with the various school districts, they're all doing different things in different ways. Yes. I know, like, for example, in my own household, I'm the one responsible for math. My wife for the science and the English education, or English language arts, they call it now. Could you, but really, what should be the expectation? I mean, parents should expect that there's support for continuing the education right now. Like that's a requirement. Is that correct?
Yes, it's a requirement that the districts talk to the parent about what they're able to do in the next 6 weeks or 5 weeks that we're down to. And that's kind of the mode that we're operating in. And so we're encouraging parents to call us if they have questions about what that looks like. But in Michigan, they're operating on what's called a continual or contingency plan for learning over the next 5 to 6 weeks. And so I think some parents are really okay with that. And then I think there's other parents who have some questions about what that really looks like for their kid in the next short term. And then, of course, if we continue in this manner, what that looks like for the fall. So again, I would encourage folks to call their regional parent mentor that's in their area, which is on the website, to get those questions answered.
Great, thanks, Sherri.
You're welcome.
Let's go to Colleen Allen next. Colleen Allen is the CEO of the Autism Alliance of Michigan, and this organization really does keep track of what is available, what's happening around the state, and what service options people have, even during the middle of a pandemic and a crisis like we're in today. Colleen, what's the Autism Alliance up to?
Thank you, Brian, and thanks for the opportunity to talk today, and to Sherri and Tim for their input as well. So just some quick background. We're a statewide professional nonprofit for those that do not know us, and our mission is pretty broad. It's to raise expectations and expand opportunities for people with autism. So, we provide the help and answers very basically. It's been a beautiful public-private partnership with the state to offer what we call our Navigator program. And you could call us with a child having a new diagnosis and not knowing where to begin, whether it's a special education question or where should I go for my therapies and will my insurance accept this provider? So we recognized early on when we were first launching as an organization the challenges around navigating multiple systems of care. And while you may have a coordinator in your health system, that person is not necessarily communicating with the same coordinator in your community mental health system or your special education system. So we want families to call us to help guide them and coordinate their services across systems. We have, some of our easier cases are connecting you to a service provider, but at the same time, we are challenged with very complex cases. We get calls for individuals that are already caught up in the criminal justice system around an encounter that was misunderstood by a first responder, or those that have landed in emergency rooms with psychiatric crisis. So we need families to know about us. This is a great opportunity to make lots of people across the state understand what it is we do. And we want to be there for you. Our other pillars of work are around employment. We know that the unemployment rate for people with disabilities, let alone autism, is very high. Estimates are anywhere from 75% to 90%, and so getting people into jobs and working with employers. And then lastly, very broadly, community awareness, education, and inclusiveness trainings. So I just, probably the most important point to make is we do everything at no cost to anyone, and we do try to help anyone who calls us. We're autism led, but we have individuals with lots of different types of disabilities that call us to connect into what they need at a given time. And, big shout out to the governor and the legislature for the support over the years. We've really not been able to do this without the state's help. And then just, briefly to speak a little bit to what we're doing in this crisis. Early on, we wanted to get information from families themselves and not make assumptions about what we thought they needed during this time. We conducted a statewide survey and had a pretty strong response rate. We have over 7,000 families we've helped across the state and sampled 1,000 with a return rate of about 400. And I'm happy to share that if there's opportunity to get information out after. But I'm just going to highlight the main findings when we asked families about what was most stressful to them at this time. It really broke out evenly around being home all day with that family member with autism, and then the concern that either they themselves would get sick or their affected family member would get sick. And we took that very seriously in terms of some of our advocacy. And as some of you on our panel know, that we have really been trying to get a clear understanding of how we defined essential in this really challenging time. But that advocacy is a piece of some other forums that we've been part of. Thank you, Sherri, for comments around special education and those challenges. We're hearing those, and the direct care wage piece. We're thrilled with the $2 and hope that will become permanent on the other side of this. But again, I won't be redundant. We are a connection to resources and some novel resources in response to what's happening all around us right now. So thanks to everyone.
All right, thank you, Colleen, for the work. I know each of these organizations are continuing their work outside of the normal way that it's delivered, and I even say that it occurs to me I didn't mention why I'm in my car right now. I mean, you do what you got to do. Right. I've got a dog, at home, and this is the only environment I can kind of control. And then, but then I also got to drive in closer to town to get a strong enough cell signal to do video conferencing. So that's why I do these in my car. So we've got about 10 minutes before the joins us.
Brian, if I may interrupt, the governor's going to be joining pretty soon here. She's running a little bit ahead of schedule, so she'll be with us in just a couple of minutes here.
All right, sounds good. So why don't we, let's just have Mark McWilliams from Michigan Protection Advocacy Services jump in and tell us a little bit about what MPAS is doing right now while we wait for the governor to hop on.
Sure, thanks, Brian. For those of you who don't know, we're a nonprofit organization. We're mandated by federal law to advocate for people with disabilities in the state of Michigan. We have attorneys and advocates. We're used to dealing with nothing but problems. This is certainly a challenging time for all of us. We're working from home. We continue to have our information and referral service that's available to anybody who has a question about disability-related rights, and those advocates are standing by to talk with you. Some of the issues that we've worked on during the COVID-19 pandemic have to deal with stopping across-the-board cuts in services. Those are often locally based and based on some interpretation, and frankly, with a lot of conflicting interests with people who are legitimately concerned about going into places and versus people who really need the services and often need face-to-face or hands-on services for people. We've worked also on the healthcare rationing issue, trying to get a policy from the state on that. We're trying to ensure equal treatment in school contingency plans. I feel like that most of what we've been doing has been trying to create and work with people in coalition. And I just want to give a shout out to the many organizations that are not here, many of which are led by people with disabilities. Certainly we're far from perfect, but we're compelled to ally ourselves with the people who know best about the issues, and those are people with disabilities themselves. They got to be at the table, and I hope that we have another town hall where those folks get a chance to talk a little bit about what they're doing and what they think. We're part of a national network of protection and advocacy agencies. You can get that information from other states, from our membership organization, the National Disability Rights Network. Our services are free of charge. We're confidential. Our toll-free number is, I think, going to be in the chat. We are working remotely, so people should call and leave a message, and a live person will actually call you back. We have a website. Our website's having some problems right now, so you might have some difficulty. You might get a warning sign. You might get redirected to a temporary site. Believe me, that is intentional, not the warning. But we're going to be redirecting people within the next week or so to a temporary site, so we can keep that going. This is a challenging time. It's at the same time, these are kinds of problems that we're not used to seeing. But at the same time, it creates opportunities for people to listen better, and it creates opportunities for people to work together in ways that we have not worked together before. So I'm hopeful that maybe going forward, we're certainly seeing issues around social equity, and we'll get a chance to maybe ask about that a little bit later, and racial equity, and that affects people with disabilities as well. So I'm hopeful that maybe we can learn from this crisis and try to get ourselves to a point where maybe we can work together in different ways and advocate in different ways in the future to really try to make some long-term changes in the problems that we know have existed for a long time.
Well, thanks, Mark, and I know that Ron from the governor's office will break in as soon as she's on. But in the meantime, if just a quick follow-up, there was actually some pretty important news came out with respect to a concern that many of us had that IDEA and FAPE requirements might be waived during this time. These are some pretty important federal laws that provide protection to our kids and the requirement for them to receive an education. Could you give us just a quick rundown of what happened this week and what it means?
Sure. So, of course, school is not business as usual. Everybody's home, and schools are scrambling to try to get lesson plans and work together for students including students with disabilities, because they are students first. And so there was an idea floated in the third version of the COVID relief package that that there would be waivers to IDEA in order to cope with the emergency, and the waiver authority would last for up to a year, which we didn't think was really necessary. And we were worried that because that if, given the opportunity, that there were some places, and keep in mind we only deal with problems, there were some places that weren't going to necessarily, they weren't going to continue to provide the kinds of supports and services that the students with disabilities needed. So we opposed the waiver authority. A number of advocacy organizations signed on. There were various opinions on that. In the end, the bill required the Secretary of Education to issue a report on recommendations for waivers. That report came out on Monday. The report said that they didn't feel like they needed any waivers for IDEA at the time, and they were not going to pursue any. So there were other waivers in that, though, you need to know about that relate to vocational rehabilitation services that somewhere down the line might be a bigger problem.
Okay, Ron?
Yep, Brian, the governor is on, so you can go ahead and get started whenever you're ready.
All right, very good. Well, so by way of introduction, of course, you all know who the governor is, and it's been an extraordinarily busy day at the Capitol, and so we definitely appreciate her taking some time to spend with us today. This discussion came about from well, it's just a simple text exchange that her and I had a few weeks ago, and then as things progressed and this was planned, she has made time, not just her staff, but her personally made some time to have this conversation. So maybe some opening comments, Governor.
All right, great. Thanks, Brian. Appreciate it. Good to see you in your car again.
Yeah, that's where I'm at.
I wanted to, Brian reached out. We've been having a good dialogue, and I know that, in this time of crisis that where everyone is struggling, we know that there are additional struggles for our communities with that represent and that are made up of Michiganders who have disabilities. And we want to ensure that resources to stay safe are available, that we are mindful of how we can move forward in a way that respects and honors and empowers people all across our state. And you and your families deserve the peace of mind right now that we're laser focused on solving problems that you are confronting, or that you are seeing, or that you are advocating on. I want you to know that my team and I are really trying to make sure that we're available and that we're sharing information and that we are nimble so that we can make a policy that really reflects problem solving that I know that you are concerned about and confronting. And that's why I wanted to jump on this call. Everyone, no matter who you are, where you live, what part of the state you're from, is important and deserves access to quality, affordable health care, deserves access to accurate information, opportunity. And this is never truer than in the midst of a global pandemic. Today I signed an executive order that ensures all patients have equitable access to healthcare resources and services during and continuing through this COVID-19 global pandemic. Under the order, all state-owned and operated healthcare facilities have got to take the necessary steps to ensure equitable, non-discriminatory allocation of medical resources. I know that that's been an ongoing concern, and that's something we wanted to make sure to be very clear about. We also require that healthcare facilities prohibit the denial of care based on stereotypes or judgments about the value of a person's life related to a disability, mental illness, or substance abuse. And facilities have got to continue providing transportation, supervision, medical care, and other services for patients with special needs. And so I know each of the decisions that I've had to execute as governor throughout this crisis, I just want to share with you, has weighed heavily on me. And I also know that it's been hard for when we close buildings It's harder for students that have disabilities and have come to rely on certain type of supports so that they have a level playing field. And so I just wanted to make sure that you know that I'm committed to ensuring you've got the support you need as we're navigating this crisis. The order that I signed earlier this month that requires school districts need to provide compensatory services for students with disabilities when the state of emergency ends. And my team and I are working closely with districts to ensure they provide support for students who need it and for their families. So this has been an exceptionally difficult time, and the source of inspiration that I find every day as we are dealing with the crisis and the stress and the sadness and the grief that people are feeling in isolation is the stories of people that are really rising to this challenge. The stories of hardship that keep me focused on why we've got to get this re-engagement right so we never have to be back in this posture again. The stories of courage and the stories of sadness, these all keep me tethered to the goal of making sure that we mitigate the harm that we're all feeling by safely re-engaging and continuing to build up our resources on the public health side, and to make sure that we are in a position that the support for the 1.4 million Michiganders who have disabilities is there in this crisis and continues long after it. And so I'm going to continue to work with you. I know many of you on this Zoom call. I am grateful for your leadership, and I want to continue to partner with you so that we are making decisions that are well-informed, that are meaningful, and that acknowledge the unique challenges that Michiganders with disabilities have and that are exacerbated during times like these. So thank you to all of you for your leadership and your partnership.
Well, thank you, Governor. And, you know, I probably should have mentioned that, of course, we have a panel of people that are on with us right now, but also the people that registered and are now watching this ended up topping 1,000 people just on the Zoom call. And then we're also, it's on Facebook Live to hit the widest audience that we possibly can. So a lot of very interested people in hearing and being a part of this conversation. You've actually, I want to make sure, I want to go back to something you just said, because it anticipated one of the questions. We had many questions come in ahead of time, and one of which was, how do we make sure that in a time of a intense pressure on our healthcare system, how do we make sure that people with disabilities are not devalued or not valued as much as others, especially when it comes to rationing and making decisions on who gets what care? And it sounded, did I hear that correctly? You signed an executive order today on that.
Yes, that's right. We did, and it was in large part because of the advocacy and education effort that all of you have undertaken to make sure that we are giving direction, that we are clear about what what we expect and what we anticipate. I think that about a month ago, all of the models had us on this really scary trajectory in terms of the spread of COVID-19, and obviously that's what drove decisions to really mitigate how much activity we have, whether it was the closing of schools or it was the closing of bars and making restaurants dine out only, or the stay home order. And because of that, we've really flattened the curve. And it's, an order can't do that, but human behavior does it. And people have reacted very positively to the actions that we've had to take and done the right thing. But certainly early on, with the overwhelming expectation of what would happen on our hospital systems, the conversation about the rationing of care was something, and I'm not saying that it's not still very valid. It is. That's why I signed the order today. But it's something that I think kind of, I'll just say that I've learned a lot in the last month and a half. And I've come to appreciate some of the stressors that people are feeling in this moment. And the thought that that would be an action that might happen was really, I think, shocking. And I know you're all like, well, we know this, like we've expected this. But it's because of your advocacy that we took the action that we did. It's because of your advocacy and the actions of the people of our state that we've pushed this curve down, and we've been able to build up our resources to make sure that we're able to care for everyone. Everyone deserves dignity, and everyone deserves treatment. And I think that that's a core principle that binds us all together. Us all on this call anyway.
Thank you, Governor. And why don't let's go now over, since that first question is actually robustly answered with an executive order. Tim Hileman is the CEO of Special Olympics Michigan. I meant to mention earlier, Tim, when you were giving a little presentation of what you're doing, some people think of Special Olympics as being for kids with intellectual and developmental disabilities, but it's for everybody. So I just wanted to make that point. Anybody who's planning on getting in touch or contact and being a part of the virtual things that Special Olympics is doing. But Tim, why don't you ask the question that you had for the governor?
Sure, thanks so much. And thank you, Governor, for being a part of this. And we really hope one day that when we're all through this, we'll see you at a polar plunge as well. But my question is, earlier in the call, as Brian shared, Special Olympics Michigan is providing, lots of resources and tools for families, individuals, other organizations. But a lot of that is through technology. And we know that there are some significant barriers regarding access to technology for those with disabilities. I think one of the positive things out of this, and you alluded to it about, groups coming together, is that there's been some wonderful public-private partnerships formed, such as, Connected Futures over in the Detroit area, providing students with technology and equipment for the transition to online learning. Has there been any conversations or work with you or at the state to start facilitating or talking about some of this access of technology, whether for special education students, adults with intellectual disabilities, just finding ways to create greater access to technology so we can continue to connect with so many individuals?
Yeah, thanks, Tim. Appreciate the question. That has been something that we've really been putting a lot of work into, and building some partnerships with philanthropy, with corporate, active partners. And we, I think, are going to be in a position where we're going to be able to announce some really good things that we've been able to do in terms of advancing technology for our students in particular. But, across the state, we've got very different assets and very different challenges. I think that one of the incredibly important aspects to our plan with regard to the education of our kids was to make sure that we acknowledge that, with the hundreds of school districts that we have, some areas don't have access to broadband or access to devices. That is a real issue in various parts of our state. And so we've been working to procure and partner to create some opportunities for online learning using, whether it's going to be laptops or tablets or cell phones. We're going to have, I think, an announcement very soon about some of the work that we've done on that front. And I think with regard to the students with special needs, I mean, that is one of our priorities as we are thinking about how do we deploy these devices to help students and meet their needs.
Great, thanks, Governor, and thanks, Tim. And why don't we go next to Mark McWilliams from Michigan Protection Advocacy Services, who has a question for you also.
Thanks, Brian, and thank you, Governor, for being part of the show today, and thank you for the executive order. It's something we've worked hard on with a number of people. My question is, the pandemic has brought Michigan's serious racial and social inequities in healthcare and education into stark focus. Do you see opportunities to make long-term progress toward achieving equity in the post-pandemic world?
I hope so, Mark. You know, if we don't learn lessons in this moment, right, we haven't lived up to our potential here. These have been some tough days. And when we know that 14% of our population is African American, and yet 40% of our casualties from COVID-19 are African American, we recognize that there is a racial component that is very real here. In my State of the State at the beginning of this year, I devoted some of my time to talk about racial disparities for moms and babies. It is 3 times more dangerous to have a baby in Michigan if you're a woman of color versus if you are a white woman. And a lot of factors go into that. Access to healthcare, access to a job that puts you on a path where you can make enough money to take care of your family. Implicit bias in the provisioning of medical care. And we didn't talk about it that way with regard to the executive order, but that is part of what we are confronting here, right, is the implicit bias in the provisioning of medical care. And so my fervent hope is that we come out of the crisis with a policy agenda that really is about tackling some of these long time issues that we have been a reality, but we haven't seen as sharply as we see right now.
Thanks, Governor and Mark. Let's go to Sherri Boyd, who is the Executive Director of the ARC Michigan. Sherri.
Thank you, Brian. Thank you, Governor. Medicaid and other programs that are essential to people with disabilities will be looked at post-pandemic to make up budget deficits. I just would like you to talk a little bit about what you can do to assure that these programs will not meet budget deficit shortfalls. Thank you.
Yes. So Sherri, thanks for the question. I'm thinking a lot about what the budget looks like. We know that this economic hit as a result of the health care crisis or health crisis that we're confronting is real, and it's big. And we're looking at probably $3 billion in the current fiscal year, which ends in September, and maybe about a $4 billion at this point in time hit to our next fiscal year. I've been working with the treasurer and the state budget office, been working with our congressional delegation. The pain that we are feeling is a direct result of COVID-19. And yet the CARES Act that Congress passed that has funding for, that is coming to the state of Michigan has so many strings attached to it that we're precluded from using it to address some of the holes in our budget as a result of COVID-19. It's really destructive. And you might have seen the Senate Majority Leader in Washington, his comments, Senator McConnell, but he has voiced a reluctance, to put it lightly, to send additional dollars to the states with the flexibility that we all really are asking for as we make decisions in our states. It is a bipartisan effort of governors who are trying to bring to bear an education of Washington, D.C. to get the kind of support that we need. State governments declaring bankruptcy is an unconscionable solution in a moment where this is a global pandemic, and the decisions we will have to make at the state level are going to be hard enough. If we could simply just have the flexibility that we need so that we can prioritize things like healthcare. It would be a shame if, I don't have the words strong enough that are appropriate for a Zoom call with all of you, but it would be criminal if at the end of this, states were forced to cut healthcare. At the end of a global pandemic that has ravaged our healthcare system and the health of our people, that we would be in a position where we would have to cut healthcare is just unconscionable. And so we're working really hard to do everything we can to mitigate the pressure on the state budget, to advocate for the flexibility that we states need, and to get additional assistance from Washington, D.C. I'm working closely with my colleagues on both sides of the aisle Mike DeWine in particular from Ohio, Republican from Ohio, Larry Hogan, Republican from Maryland, my fellow Democratic governors, because we all need this kind of support out of Washington, D.C. And to the extent that you're able to lend support, I think that would be really important and helpful.
Governor, in just a bit of a follow-up to that, because I don't want it to be lost, some of the numbers that you just shared, perhaps $3 billion in the current fiscal year, $4 billion in the next fiscal year. What kind of time frame do you think it is between now and when? I know you've already had to do some layoffs among the state government workforce, but in terms of like drastic changes, what's the timeline that we would have to see some action before Congress before really starting to feel these things?
Well, we have our May revenue estimating conference on May 15th, and that's when we'll have a little bit better picture. I think that there are so many unknowns, which is the hard part of this moment. Other states have budgets that start in July. The fact that ours starts a little bit later can be viewed as a good thing in that regard. However, we've got more time that we could try to absorb, quote unquote, absorb these cuts. And so it could work to our, it could work against us. I think that we're going to have to make some tough decisions, and I'm hopeful that Congress takes action in May at some point this coming month, because in order for us to be nimble enough to balance a budget, and we need to know what we can do with these dollars that have come into the state. And if they have strings attached to them such that they can only be used for prospective costs associated with COVID-19, it means I can't spend them on healthcare that we know is a current need. It means we can't spend them to wrap our kids with the supports that they need to make sure that their educational needs are met. And so it's very problematic if we don't get at least flexibility in what has come in, and additional dollars hopefully as well.
Well, clearly with the amount of interest that we have on this call, I think to the extent that you can share some messaging that would be appropriate to share at a federal level about the support the state needs, especially in order to maintain the services to families like are watching here. As I think you well know, this is a really powerful network of ambitious people when it comes to advocacy and reaching out. That I hope that you'll consider tapping this group. Help with that message.
Absolutely. I would love to work with you on that, and we will share that with you, Brian, and assume that that's how it'll get disseminated, because I do know that this is a fierce group of advocates. I have an incredible amount of respect for you, and I have to believe that our congressional delegation does as well.
Great, thank you. So I want to now turn it over to Colleen Allen from the Autism Alliance of Michigan. Colleen, your question?
Sure. Thank you, Governor, for everything you're doing, and especially giving us this hour. I know how difficult it must have been to carve out. So mine is a little lengthy, but just bear with me here. So we know there's been efforts to integrate behavioral health support within education and special education settings, and we really applaud those initiatives. However, now more than ever, many children could benefit from intensive behavioral and clinical therapies to regain those lost skills during this period. So my question is, are there opportunities to really utilize community-based disability agencies and autism service providers to supplement that special education instruction and compensatory learning? It feels like it's going to require some real innovative approaches to break down the service system silos to assure best outcomes for children and young adults with autism and other disabilities.
Yeah, thanks, Colleen, and thanks for all the work that you do at the Autism Alliance. I think that if there is, I'm an eternal optimist, and I have to find something good, even in the worst crisis that we've confronted in our lifetimes in terms of this global pandemic and what it has meant to our people. I believe that this is going to be the impetus for us to really fashion relationships in a stronger way than we've had in the past. And that's not to say that they haven't been strong in the past. It's just we now have a unique challenge that is going to be requiring that we are creative, that we are collaborative, that we are asking for assistance in ways that we never imagined we would need to. And I think that I know that I don't have all the answers. I know that I've got a team of incredibly bright people that are working so hard to make sure that we are meeting, the needs that you've articulated. And yet I know also that we have our limitations, and that's why I think I'd love to know where you think those opportunities are and what that might look like and how we execute and make it a reality. Yeah. In this moment, we can cut a lot of red tape that might ordinarily keep us from pursuing some different ways of meeting needs. And so I think that I would love for you to be a part of designing what something might look like, and for you to really help direct how we do this.
Yeah, happy to. I do have some ideas.
I know you do. I know that wasn't an idle question, Colleen. Governor, and if I could just highlight one thing that the administration is doing on this front. The administration consulted with special education experts, including one of our panelists today, Mark McWilliams, from the Michigan Advocacy and Protective Services, in crafting the special education section of the governor's K-12 executive order. His input was particularly valuable, and we implemented many of his recommendations. And after this call, I can certainly share the information that's in that executive order to be sent out to everyone as well. And like the governor said, we can absolutely continue working together to make sure that we meet more of those standards that you mentioned, Calley.
All right, well, thank you. Thanks, Ron. And Governor, as our time winds down, I thought what we could do is we've gone through each of the panelists and some questions that they had collected here ahead of time is to give you an opportunity to pull it all together and for whatever message you want to deliver to this group of people that has really been, I know is very appreciative from hearing from today, but also a desire to be a part of creating the type of future where they and their loved ones can thrive.
I guess it's this, we are so inundated trying to manage in a crisis that we could never have anticipated. It's been hard, and it's one of those moments, though, where I think it's more important than ever that we are reaching out and that we are listening and learning and moving fast, but being mindful and inclusive. And I think, Brian, when you sent me the email, I think that, or text message, I guess it's text message, that's how we usually communicate, kind of describing the need and the concern that you had, and being very real about it. I think that's when we started to really mobilize to focus on this. We have lots of different balls that we are trying to keep in the air and focus on, and to continue moving forward. As we are looking to re-engage sectors of our economy, worker safety is absolutely critical as we ramp up public health. And I know that the community that you all are here to advocate for and represent probably has got a lot of thoughts on both of those subjects, whether it's public health and worker safety. And so I think that, the staying connected and staying close is really going to be critical, so that as we're making decisions, as we're trying to move fast and be inclusive and thoughtful, that we really are, have the best information available, so that where there are things to do that can really be meaningful, we know what they are. And that's why I need your help on. The budget pressures are going to be very real. And that's another place where I think that your advocacy can really make a difference and can be powerful. But I guess the most important thing is sharing your thoughts and your counsel and helping us devise solutions that really make a difference and improve our outcomes for Michiganders with disabilities and families that are trying to navigate this new moment and do right by their loved ones as well. So I think that's the most powerful way that we can stay close and make a big difference together as we are taking steps in this unknown, unforeseen moment, and come out the other side with additional, plans for the next step in a non-crisis moment.
Well, thank you, Governor. And, there's some organizations that were directly a part of pulling this audience together, and there are multiples more that do similar and important work out there across the landscape. And so I suspect that they will definitely take you up on that offer. So as we close out, then I want to thank the transcriptionists and the sign language interpreters who have been on this call to make it accessible to as many people as possible. Thank you to all the people that signed up and were a part of it. And no matter how long or how wide you make these things or how many invitations that you can get, it's impossible to get to everyone. But I know that the governor is open to hearing directly from you in her constituent services operation, and of course the organizations that you're a part of, speaking with and through them in a very effective way too. So thank you for participating tonight. Good luck in the future, and I hope that we'll be in touch real soon. Bye,
Thank
everybody.
you, everybody. Thank you.